you.
Wasa Iati, Cindy Gamble here, consultant with the American Indian Health Commission. JanMarie and I are very pleased to give you this update. Next slide. In 2019, the Maternal Mortality Review Panel report to the legislature was released, and it showed an alarming disparity for Native maternal health. And the delegates, the commission delegates were very concerned about this, and this resulted in the Maternal Mortality Listening Session project. Now, we wanted to approach this more holistically, so we thought about conversations about the health of Native pregnant, birthing, and postpartum people. We were hoping to have this real live regional listening session conversations, but because of COVID, we did have to plan to do virtual. So our initial plan was to have 3 community conversations at different times, and then take all of that information, synthesize it, and present it to leadership for their recommendations. And the recommendations would then be put in a written report and included in the Department of Health's report to the legislature and governor. So our initial plan of 3 community sessions was great. We held them last week, but they were very well received. We had much rich information and wisdom, and we received invitations to continue the work and actually come and do on-site presentations. So our leadership listening sessions will be in the future, and so please stay tuned for that. A part of the maternal mortality work is also we are partnering with the National Indian Health Board. They are conducting a survey nationwide to see what tribes and urban Indian programs think about the potential for establishing tribally led maternal mortality review committees. Next slide, please. So we have the survey on this link. We hope that you will all participate and answer the questions. This is very important information to receive, and more details to follow. Next slide, please. Some other work with maternal infant health is definitely our MIH Work Group. The 2 projects we're working on with them right now is a baseline survey on resources available to pregnant and parenting and birthing people in their own communities, and also the maternal infant health data sheets. We want to ask your help regarding the data sheets. We are looking for stories, personal stories, if people have some to share about their experiences while pregnant and birthing and postpartum. So I will turn it over to JanMarie now.
Thank you, Cindy. JanMarie Ward. I've returned to my maiden name. Most of you know me by the last name of Olmsted, but I'm going by Ward now. So, so what I will share is a few things. One having to do with an affinity work group that is actually a CMS initiative that the Department of Health and the Healthcare Authority are working in collaboration and have invited us to participate in this learning initiative to establish equitable access and quality of well child's visits from birth to 12 months. Early on in this process, it was clear that, based upon our input and also perspectives as well from agencies, that we really wanted to make certain that our efforts would result in tribally led, culturally appropriate measures. And looking at what wellness measures may be from a tribal community perspective. So we kind of branched off from that national work group and are focused on doing that work just here within the state of Washington. and developing a format to best engage with tribes in American Indian, Alaska Native communities. And so we're doing that. It's early on in this work, so we're just doing that grounding work right now. Another one of the projects that Cindy and I are working on together has to do with the foundational public health services, the statewide work group that's focused on life course work. We tend to call that seven generations work, but life course work that is focused on what the priorities are across the state within the health jurisdictions that are working on that life course work. And what we're doing is identifying the priorities that are already existing priorities that have been supported by tribal leadership through the American Indian Health Commission's annual priority process and or prioritization process. So the three areas that we're focused on there in terms of alignment has to do with support for tribal prams, home visiting, and finding ways to support home visiting, provider types perhaps, and reimbursement mechanisms. And then the third and final one is the maternal infant health strategic plan. And we know that that this has long been a priority area for the commission when tribal and urban Indian leaders came together quite a long time ago and prioritized this area. Well, it's been well over 10 years now. It is really time for us to focus on doing the evaluation on those 30 some recommendations and figuring out a path forward to update that plan. So that's part of the work. Okay, next slide. And Cindy.
Thank you, JanMarie. So we all know that resources are really important and support is really important for our overall maternal infant health. And WIC is one of the greatest partners for this. And our WIC project has been very busy in the last couple months. The USDA did call for a tribal consultation November 30th. And so Vicki Lowe immediately called a tribal caucus. We had a great tribal caucus, and so the Washington Tribes and Urban Indian programs met and were prepared, and really we had a great representation at the tribal consultation, the national tribal consultation on November 30th. There were a lot of very important issues that were brought up, administrative issues, participant benefit issues. We did have a follow-up meeting with the Western region. They really wanted to know and understand more information about the issues that were brought up. And here at the local level, also the Office of Nutrition Services WIC program at the state level also wanted to have more understanding of what are the challenges that tribal WIC project programs in the state of Washington are facing. And so we also had a listening session on March 24th with tribal WIC programs and the Office of Nutrition Services, which was really another great session. And when we talked about next steps, they all said, we want to meet again. And so that is really great. Other projects that we're working on, WIC Engagement and Retention Project about reaching out to Native families who are eligible for WIC, getting them to sign up and maintain their presence in the program. We also have a great breastfeeding engagement project. And one of the issues that came up at the tribal listening session was the need for native WIC materials. And so luckily, we have a project that we are already in discussion with several tribes about. So a lot going on. Thank you so much, JanMarie.
So thank you for your attention this morning, afternoon, or whenever you are actually accessing this video. It's been kind of fun to do this, but if you have questions about any of these projects, please feel free to reach out to either one of us. And I know Cindy is just always really excited when anyone reaches out about questions about MIH. Thank you, everyone.